Hi everyone, in this lesson you're going to start on the first of the 5 psychological disorders that are part of the clinical psychology syllabus. So in this lesson we're going to start looking at schizophrenia. This is a very basic overview, so you should watch this in order to be able to understand how you can define schizophrenia, what the symptoms look like, and what sort of diagnostic process there is, very broadly defined, when a clinician or clinical psychologist is looking to assess somebody for schizophrenia. So let's begin. First thing you need to remember is that schizophrenia is classified as a psychotic disorder. Psychotic disorders are defined as disorders where there is a break from reality. And in fact, if you start to look at the word schizophrenia itself, you will see schizo actually stands for split and phrenia represents mind. So schizophrenia is really it's a disorder which represents a complete disconnect or break from reality, which is why it is called a psychotic disorder, classified within the range of psychotic disorders in clinical psychology. And as I also mentioned about this split mind, you can see this here. And this little diagram is simply supposed to show you that when a person has schizophrenia, you will see activity in regions of the brain where a typical person who does not have schizophrenia would not have that kind of level of activity. So again, something to keep in mind. Also remember that schizophrenia is classified as a heterogeneous disorder, and what this means is that it has multiple causes, and I'll take you back to the nature versus nurture debate that you really learned in AS, and you should know it underpins all of psychology. But when you talk about schizophrenia, it's also a very good example of how it's not always possible to separate between nature and nurture, nor should we really, because nature and nurture interact with each other to produce behaviors and also in this case to produce psychological disorders. To be more specific, schizophrenia is classified as a heterogeneous disorder because you see that there are genetic components to it, there are environmental components to it, and there are also other physiological components to it, as I was just talking about when I was telling you about the activity in the brain regions of a person who has schizophrenia. Last thing you should know is that it is a chronic disease. It is a chronic disorder, rather it's a chronic illness. Chronic means that it is constant. It is not something that will only occur in an episode. It is something that is ongoing. So for example, if you get the flu every winter, that's not a chronic illness. But if, God forbid, you have some sort of deficiency, let's say you have anemia can also be chronic. It's a chronic iron deficiency, so you have to be very careful to prevent it from adversely affecting your health. Now, these are the 3 basic characteristics of schizophrenia, that it is first of all a psychotic disorder. People who have schizophrenia are not able to differentiate between reality and between what is in their imagination. People who have schizophrenia may have it because of multiple reasons. There is a genetic component to it, but it can also be triggered by severe environmental stress factors, and it can also be something that is made worse by physiological processes, by a lack of control, for example, in the levels of dopamine within a person's brain. And so again, multiple causes, very complex, heterogeneous illness, and it is one that is chronic. It is not something that is episodic. It is an ongoing, lifelong condition that then has to be managed. So now we're going to go on and look at 2 key stages within the within the development of schizophrenia. Now, when you're trying to ascertain whether a person has schizophrenia or not, it's called a diagnostic process. within the diagnostic process, and we do dive into everything in more detail as you move through these lessons, but broadly speaking, what you need to know is that typically when a clinician encounters somebody who's brought in who may have schizophrenia, if the symptoms are mild, but they do fall into the symptoms that are associated with schizophrenia, that person can be seen as being in the prodromal stage. The prodromal stage is also a stage that is quite difficult to diagnose schizophrenia in, because the symptoms are quite mild. The core symptoms are mild, and it is hard, especially also in children, and you will learn that when we talk about the example study. But this stage is the prodromal stage, and it is difficult to accurately diagnose schizophrenia at this stage. But sadly, the other reality is that about 70% of the people who are in the prodromal stage will go on to develop what we call the active stage of schizophrenia, or full psychosis within schizophrenia. And the active stage is where all of the symptoms that I'm going to talk about in just a minute, where all of the symptoms are no longer mild, the symptoms are severe. And when a person has reached the active stage, it is again a more complex process of treatment, and you will also learn a little bit more about that when we look at the example study, and then later as we move through the causes. So just basically remember that diagnosis at the prodromal stage is quite difficult to make, because the symptoms are mild and it's hard to tell if they are actually schizophrenia symptoms or are something else. And when a person reaches the active stage, which 70% of prodromal people may, then it is a point at which the symptoms are severe, they are persistent. So let's look at how the diagnosticians or the clinical psychologists actually ascertain the presence of schizophrenia. What do they use? So you already know that there are two sort of very commonly used diagnostic manuals. You have heard about the DSM-5 in our prior lessons, and you have also been told about the ICD-11, which is the International Classification of Diseases. The ICD-11 is essentially the 11th version of this ICD, or of this manual, and it's published by the World Health Organization. It covers all sorts of diseases and disorders, including mental illness or psychological disorders. For your purposes within the Cambridge syllabus, you are going to be using the ICD throughout for all of your different psychological disorders that you're going to study.
Quick pause. If you're finding value in this explanation, there's so much more to discover at Alt Academy, where we break down every A-level concept with the same clarity. Now back to the video lesson.
But what you should know is that within the ICD, the way diagnosis is made is that for schizophrenia, and let me just specify that, for schizophrenia, the clinician has to look at 6 dimensions of symptoms, or rather symptoms are ranged across these 6 dimensions, and within each dimension there is a 4-point scale. That 4-point scale goes from not present all the way to severe. Right? So you've got not present, mildly present, not severe, and severe. And then the other thing the clinician has to do is that, let's say they look at the symptoms and they say, okay, well, hallucinations, which we'll talk about later, are present, and they rate that at a severe for hallucinations. But the clinician also needs to make sure that the symptom of hallucination is not, for example, because of drug abuse. So within the diagnostic criteria, there are certain things that you need to ascertain. The first thing is the clinician will rank, or yes, he will actually rate across these 6 dimensions. For each of the dimensions, which symptom is how severe or not present, and also during this must ensure that if a symptom is present, it is actually not for any other reason such as drug abuse or other medication, for example. And there are also certain symptoms that will not be indicative of schizophrenia, and that means simply that they may indicate the presence of a different disorder. So clinicians have to be extremely careful when they are using this diagnostic criteria within the ICD-11 to ascertain whether somebody has schizophrenia or not. So now let's look at these positive, negative, and other symptoms very, very quickly, and you will be covering them in later lessons. So the first positive symptom, and these are core positive symptoms, meaning that they are extremely central to the diagnosis of schizophrenia. The first one is hallucinations. So something felt or seen or heard, but it doesn't actually exist. The second one you need to know is the feeling or experience of being controlled by an outside influence. So experience, let's just call it experience of passivity. Passivity is a state where you feel like you can't do anything, you have no control over anything. Then you've got delusions. Delusions are essentially false and fixed beliefs that actually completely contradict reality. So these are the 3 core positive symptoms. There are other positive symptoms as well. Positive simply means the presence of psychological dysfunction. Negative, on the other hand, means the absence of psychological functioning, or rather the absence of what are normal psychological functions. So negative symptoms will include, for instance, they include something called asociality, which is complete social withdrawal, complete isolation. And you know that human beings are by nature social animals, so again represents the absence of normal psychological functioning. Another example of negative symptoms is called alogia, where the person essentially stops talking. Again, communication or language, you'll remember this from cognition, is a really fundamental part of being a human, and so this does represent the absence of normal psychological functioning. Yet another example is something called flat affect. Flat affect is the inability to really have any sort of emotional expression the way that a typical person would. If you have schizophrenia, you're not able to. And then some other symptoms which may overlap with other disorders, for example, are sadness and aggression. So again, you're seeing that there's a very complex set of symptoms that represent schizophrenia, and within these symptoms, as you will learn in our later lessons, there's a lot more to really look at for the clinician. So this very broad overview of these symptoms. Remember, positive means the presence of dysfunction, negative means the absence of normal, typical psychological functioning, and there are other symptoms. They are related to mood, they are related to cognition, and sometimes also behavior. Now, lastly, we're going to talk about the onset and prevalence of this psychological disorder. So onset essentially means when is it most likely for a disorder to begin, okay? And prevalence means at any given point in time, at a point in time, how many people have the existing condition. Meaning that it is not a new case that has just been diagnosed, it already exists within that population. And here what you're looking at is prevalence within females and males. So when you talk about onset, you will actually find that onset in males and females is quite different, and we'll look at that in a second in terms of age, how old men and women typically are when they develop schizophrenia. And prevalence, however, for men and for women, for males and females, prevalence is very similar, meaning that a similar percentage of men and a similar percentage of women in an existing population will have schizophrenia at a given point in time. So when we're talking about onset, as you can see here, this dotted line is for female schizophrenia patients. This is taken from a recent research paper, and as you can see that for female schizophrenia patients, onset is around the late 20s. However, for male schizophrenia patients, it is around the early 20s. And that is just a small thing that you should keep in mind, because for different disorders, you will see this again, onset and prevalence can be different based on gender. In the case of schizophrenia, prevalence is similar, but the age of onset is different in men and women. Lastly, remember that it is rare to see very early onset schizophrenia cases, meaning children who have schizophrenia are rare, or adolescents. Now let's sum it all up. So schizophrenia is a chronic illness. It is continuing. It represents a complete break from reality. It is a psychotic disorder. It is heterogeneous. It has multiple causes. It has two different stages, the prodromal stage and the active stage. Prodromal is when the symptoms are quite mild. Active is when full psychosis has set in. There are 6 dimensions of symptoms within the ICD-11, and for each of these dimensions, the clinical psychologist rates the patient's demonstration of symptoms on a scale of 1 to 4, not present to severe. There are gender differences in the onset of schizophrenia, the age of onset, but there aren't any as such in the rate of prevalence. And cultural differences should be accounted for because, for example, hallucinations as diagnosed as pathology, which is where you see that there's a presence of a disease. In the case of schizophrenia, if you're trying to ascertain whether someone has schizophrenia because they're hallucinating, you must also keep in mind that in some cultures, for example, shamans in Latin America will consume certain hallucinogenics in order to hallucinate, and that does not mean that they have a pathology. That does not represent schizophrenia. So just some basics for you to keep in mind as we now dig deeper into the symptom sets.
Hey there! If you found this A-level psychology lesson helpful, why don't you head on over to altacademy.org, where you can sign up for the full A-level psychology course. In addition to psychology, we offered 7 other A-level subjects. Thousands of students have already taken the leap. What are you waiting for? I want to see you there.